I live in the South Bronx. I'm with Vocal New York.
I do some clinical work, and then I also work with the San Francisco Drug Users Union.
I'm a researcher in the field of public health, and I'm here because France is going to open the first safer injecting facility.
Coming here was an opportunity to see a real model of a continuum of services on the ground that's truly comprehensive.
It's great pleasure to come, to come here to Vancouver and see everything that's going on.
We've gone on a sort of whirlwind tour of all these amazing services run by the Portland. It's like they see something they want to do, and they just go and do it.
When I spoke with Elizabeth, who does this outreach, it's her life. She's been doing it in some of the roughest parts of New York City for years now. And for her, it's just she's like, everything's percolating. I can't stop thinking. I have so many ideas, and she can't wait to go back and share all of this with her organization and with her colleagues. And yeah, I think it's just inspired people, really.
When I was at the Drug Users Resource Center and watched them do political action planning, these guys all together making a plan to have their community saved. And I had to jump in and let them know what was going on. Y'all guys, they the bomb diggity. You hear me? You want me to come up closer so you can see? I'm proud of each and every last one of y'all. Fight for what you know. Let them know what you're about. Let them know that you haven't met me yet. Do not labelize me. Do not discriminate against me for the fact you haven't sat down and talked to me yet. See, I'm a 6-foot-tall woman, so I just get my way.
I'm just going through so many thoughts and emotions in my head right now. I'm gonna come back with so much so much inspiration for one, and so much thought about all of the ways that things could be is so useful. I'm trying to take notes on my arms because I don't have anywhere to write stuff down. I'm I have to remember all this stuff about how all this works.
Easy to feel this respectful relationship between all these people. It's great.
I think it's a sense of solidarity, realizing, meeting the drug user groups, for example, and feeling like this is an issue that everyone is working on all over the world. And then I think getting a little bit re-energized, because it's so difficult in some of these countries and some of these contexts to be working on these issues.
All of us who work in harm reduction have a tendency to sort of be here, our focus is very narrow because it has to be. It's so demanding all the time. The need is so great, and in some places far more than in others, but generally we get tunnel vision, and it's really crucial to remind ourselves that we need to see the bigger picture of what's going on in our political analysis of what's going on with drug war and prohibition.
We're all operating in the same environment of punitive policies towards people who use drugs, and I think it's very valuable to make that connection and to recognize that in that kind of the similarity of the struggle that we all encounter in our daily work, and trying to overcome that struggle together is much more valuable. So how we can find ways to continue to build networks and support one another, I think, is the sort of way that we're going to eventually overcome this flawed idea of the war on drugs.
If I ever leave Vocal, I'm coming to Vancouver.